Well, first, let me assure you that Nancy Johnson and I are among the non-dancing former members. We've pursued other careers, and it's good to be on the panel with the two current members of Congress. Mike Burgess and I shared some territory. He inherited some of my old district. Mike Burgess is a very dedicated member of Congress. We're in different parties, but works very hard at his job. And of course, the senator I don't know well, though I was mentioning that my godson, who just graduated from West Point, is a constituent of his from Newcastle, Wyoming. And we will have another conversation in another venue about what happens in Afghanistan. But it's good to be here. I was in Congress for 26 years, was chairman of the Democratic Congressional Campaign Committee at one point, was chairman of the Democratic Caucus, in addition to being on the Budget and the Rules Committee. So I do have some interest in what's going on. Nancy, of course, dealt directly with healthcare matters as a member of Ways and Means for some time. It is clear that something is going to pass. Now, they may differ with me. They may feel that this whole thing is going to play out and we'll wind up with no result at the end. I believe something will pass. I think that they've already indicated the problems with pre-existing conditions and the ability to continue your insurance when you change jobs, move across state lines, also when you have a serious illness. So everybody agrees on that. The question is, what do you add to that? And where we may depart, I don't know because they didn't speak directly to this, is what do you do about the millions and millions of people who don't have insurance right now and in many cases can't afford to have insurance? Now, you do have some people who voluntarily opt not to have coverage. I have a daughter like that who's 29 years old, and we had a very long conversation at one point, and I explained to her that if she didn't have insurance, Dad would wind up paying for the medical bills if she got seriously injured or had a serious illness, so she now has insurance with some assistance from Dad. But there are an awful lot of people who fall in that category, who can't afford insurance as it's currently offered. And that has to be addressed. And the question is, how much subsidy does government provide for those people? Is there a mandate requiring them to have insurance? And what do we do about employers in terms of their requirement for them to provide insurance for their employees? And the biggest problem, of course, as they've already indicated, is how you pay for this. Because I believe that these two members, as well as virtually everyone else who's currently serving, really do not want to see whatever is passed add a penny to the deficit. And that gets to be very, very difficult. If I were a current member of Congress, I'm not sure what I would vote for on how to pay for this. But I would not vote for a bill that wasn't paid for. And that has to be sorted out between the House and the Senate because they have very different ideas. I will be surprised if whatever ultimately emerges has an income tax surcharge as a permanent part of it, because that could take, with the increased rates that are going to in effect when the Bush tax cuts expire, that takes the maximum rate to 39.6, and if you put a 5% income tax surcharge on top of that, that gets the maximum rate to 45%. I will be very surprised in the final analysis if Congress is going to do that. But I do think that Congress will find a way to pay for this. The other part of this, and Nancy can comment even more in more detail on this, having been on Ways and Means, is it is very difficult to cut Medicare when you're a member of Congress. And we went up and down that hill on a number of occasions, and when you actually it comes down to voting for specific cuts in Medicare, Congress shies away. So this gets to be very interesting because how do you're going to pay for this, you're going to have some cuts in Medicare, and you're going to have some increases in revenue. And I trust that the current members will figure this out. I think it would be wrong for Congress to walk away from this issue and not provide coverage for millions of people who don't currently have it, at least provide a path for them to get that coverage. Projections are, right now, 47, 48 million people don't have insurance. Projections are that could go up to 61 million by the year 2020. And we've seen the cost of insurance go up dramatically for individuals. Something has to be done about that. And we've seen a lot of people, a large percentage of people who have applied for insurance been denied on the basis of either pre-existing conditions or have seen their insurance taken away from them after they have a serious illness. So I believe Congress is going to figure this out. I wish you well, and these are both constructive members. I'm not suggesting that you have to pledge you're going to vote for something, because both of you may wind up voting no, but I hope that you are a part of the process of making the product better as it moves through Congress.